This is the focus workshop of the European Federation of Periodontology with the European Academy of Pediatric Dentistry on gingival and periodontal diseases and conditions in children and adolescents. We have discussed in 3 working groups about gingival and periodontal diseases in children and adolescents. How similar are they with the conditions that we find very frequently in adults? In the working group number 1, they have discussed on the impact of different systemic diseases on the periodontal tissues and on periodontal diseases. And I don't know if, Dominique, you have concluded something that could help the clinicians in their practices.
Absolutely. I think the outcome of this workshop will be a nice overview of the impact of systemic conditions, whether they are genetic, inherited, or acquired, on the periodontal condition of the patient. And we will have a nice table listing all the different conditions and also the way how we can manage them. So I think this will be really a landmark document for pediatric dentists to use for education and training, but also for the management of our patients.
In the second group, they actually focus on gingival diseases. So how these gingival diseases are similar or they are different to the ones that we know a lot because we have studied extensively in adults. So we have Fibos Madianos here, and he was part of working group 2. So what are the clinical implications of the discussion that you have had in your group?
Yeah, thanks, David. I think that putting the focus, as you said, on gingival diseases, on gingivitis, gingival inflammation is such an early age, let's say, group in children and adolescents, I think, and will really have a huge impact on the periodontal health of the adult population, because by learning how to diagnose them and how to manage them better, I think it will impact on the periodontal health of the adult population and how we can reduce the sequelae of periodontal disease in adults, both locally and systemically. And I have to also add that this has been missing from our work as well, and I would like to congratulate both organizations for putting together this workshop.
Okay, and in working group 3, we have tackled periodontitis and other periodontal conditions. And I think the main conclusion is that we have low prevalence for periodontitis in children and adolescents. However, it is so important to have an early diagnosis of the condition that we should pay more attention to this, the situation of the gums, the condition of the periodontium in children and adolescents. Even though the prevalence of periodontitis will be lower, the management, the early diagnosis should start very soon in life. So we really need to focus more on the periodontal condition in children and adolescents. And I thank Dominique and I thank Fibos for this very interesting conversation.